Well, there's so much to talk about, right? With sports medicine these days, you got all the fall sports, you got the marathon coming up, it's football season and more. So let's bring him in from Sports Medicine Center, my good friend, Dr. Joe Congedi, on board with us again on this Wednesday morning. Good morning, Joe, and what do you have for us today?
Hey, Ray, I really wanted to go to all this new stuff going on, to an older injury that occurred and recently. And so, yeah, it was the time of year, usually around week 2 or 3, where the quarterbacks start going down and the football players start going down in the fall. We had, Joe Burrow and J.J. McCarthy, and everybody's trying to figure out Jaden Daniels and Justin Fields. But we had, of course, in Cleveland sports, a strange injury that occurred a couple weeks ago. We're really looking forward to, this great Guardians run, but also the Cavs should be really good this year. And yet we're probably hurting most in wing players and ball handlers, and we find out that Max Strus has an injury. It's an older one that I've taken care of so many times in my career, and I just wanted to explain to people about a Jones fracture. Now, I have no idea how in the middle of August this basketball player gets a Jones fracture. They usually occur at times of high volume, but athletes play year-round now, and we don't know what. But Max Strus is probably going to be out for 3 to 4 months. We really kind of needed him with Ty Jerome being elsewhere and needing ball handlers and wings. But it's a real common sports injury. I've seen so many in my career, and I just wanted to let people know it's a head-scratcher sometimes, because in the last 25 years it's changed so much. It's just an injury that doesn't heal well. So we have really kind of gone in athletes that are somewhat serious about their sports or very serious about their sports to often our orthopedic partners fix it surgically in the first week. Very early on, they fix this injury, because it doesn't heal well. It has what's called a dreaded black line. It's in a bad spot. It's one of about 4 or 5 fractures that don't heal well. So people really say, hey, just why don't we cast or boot these people? And we still do with people that aren't serious athletes, but for a lot of people, it gets fixed pretty quick, even in our high school kids and college kids. I rarely see it before high school, but it's a straightforward injury. It's been around a long time. The one thing about it is location. It's on the outside of the foot, and these people have trouble walking on the outside of their foot and real localized pain. But there's 3 different injuries that can occur in a very small space. Right on the tip, if you look at the outside of your foot, there's a bump on the outside of your foot. There's a tubercle. And a lot of our young kids, the tendons actually pull off a piece of that little bone called the tubercle. That's not a Jones fracture. That's one where people are back playing in weeks, 2 or 3 weeks often playing. In a stiff-soled shoe. There's one in the mid-shaft, and your cross-country kids who run a lot this time of year in the middle of that bone, the 5th metatarsal, get a stress fracture. Our cross-country kids get it a lot, and it is the typical 4 to 6 weeks. But the one that's between those, where the bone kind of flattens out and straightens out, is this smudgy-looking injury. It's usually diagnosed just by an X-ray, so not the fancy MRI, unless there's something really odd going on. Most of the time, people don't order MRIs on these, and most of the time, people fix the Jones fractures very early on, because it's called the dreaded black line. And if it doesn't heal well, it can be 6 months or a year and before you play again. So most people don't mess around with it. Things have changed with that. It's an old injury, first diagnosed 1902 by a famous orthopedist in England by the name of Sir Robert Jones. And then it seems almost that long ago when Jim Jones in 1976 broke that bone, and it really derailed the Miracle of Richfield, another championship we really would have had. He's now been, of course, the color commentator for many years for the Cavs. But also in Ohio, a really well-known kid in 1985 was headed to the Heisman Trophy and maybe a championship and all this. Keith Byers, and he broke it again a couple times, and that was one of the ones that we started to see this dreaded black line, and we said, we got to fix this thing. So most of the time they go with screw fixation, surgery, has a 90+% success rate. It's pretty straightforward, but it is 3 to 4 months, and the Cavs will be missing this wing player, Max Strus, for 3 to 4 months or more. It's caused by high volume play, playing a lot. It's caused by poorly fitted shoes. It's caused by running on an uneven surface. And so when people have this injury known as a Jones fracture, most of the time they need to be fixed.
Thanks, Joe. And again, looking at that with him, he missed the first couple of months last year as well. So, Max Strus, hopefully he can get back. Joe, I saw something, and I hate to catch you off guard, but I thought about this yesterday. The head coach of the Los Angeles Rams, McVay, on the sidelines on Sunday, he was running up the sidelines on a call, and it said he tore his plantar's fasciitis.
Yes.
And you and I have often talked about that injury, but I don't know if we've ever talked about tearing that. And I was just wondering, and I know you don't know any x-rays or anything in regards to him, is that a common type of injury? And if it is, how long does it take to recover from something like that?
Hey, I missed that injury. What the heck, Ray? You're good. You're all over this stuff. By the way, he has an Ohio tie. Wasn't he Miami of Ohio?
I believe he was, yes.
Yeah. Ray, we've talked about it being a big band of connective tissue on the bottom of our foot, like a shock absorber, like a trampoline. But many of us, if you keep kind of getting micro tears and then heal and micro tear and heal and micro tear and heal, many only in really adults will we see actually a full tear or even a rupture of that plantar fasciitis. Some people think that tears of the plantar fasciitis actually cause people to be less in pain. The pain finally kind of goes away, and they allow it to heal. But it heals with scar tissue, and because of that, there will be tears. But they're not the same kind of tear at all of the other side of the heel bone of like the Achilles tendon. They're not a terrible deal. We allow them to heal. They heal it on their own. They don't usually need surgery. Rarely need surgery. And so, yes, definitely people can get these micro tears or smaller tears or mild tears, and then after you've had these one after another, then you'll get a more significant tear sometimes, Ray.
Gotcha. All right. Thanks, man. I knew you would have it. As always, Joe, thanks for the insight, the education in the
Ray,
world of sport. Yeah, go ahead.
One more thing is I just wanted to just have people, our longtime trainer in town for the University of Akron and for us at sports medicine when we got off the ground in 1987, his name Don Marshall, knows a lot of people in our town. Don just passed away this week. And real loss for us. I always talk about trainers, how they're the key people in sports medicine. He was a key person in helping us recruit a lot of good athletic trainers to the Akron area and was our head trainer for a long time. And so we just prayers and thoughts for his family today.
All right. Glad you were able to do that. Thanks, Joe. Appreciate it, man.
Thanks, Zach. Take care. Have a good week, okay?
You too. Dr. Joe Congini, Sports Medicine Center, Akron Children's Hospital with us.